So, welcome everybody. Welcome to this Palace of the Academies. The Royal Academies of Science and Arts and the Royal Academies of Medicine took up residence in this building in 1876. It was, of course, originally built for the Prince of Orange between 1823 and 1825 and is a pure example of neoclassicism. Today, both Academies of Medicine united with FEAM, ALLEA, and the Académie nationale de médecine de France to organize the Conference on Migration, Health and Medicine. This is a difficult topic with many challenges for Europe and of concern for all European countries. Many aspects of migration will be dealt with today, including migrants' health, public health implications, economic implications, and FEAM is, of course, particularly important since it has an advisory role for European authorities. I am convinced the debates will be lively and that this gathering may provide some insights and new thoughts for the complexity of migration in Europe and beyond. And then I leave the word to my colleague, the president of the AFNB.
Ladies and gentlemen, good morning. I will only say a few words because you are here to listen to experts on health and migration and not myself. We are very proud, both Academies of Medicine of Belgium, to welcome all of you here in Brussels for this symposium. Symposium that has been organized, as you know, by FEAM. This is the Federation of European Academies of Medicine, and its president will be now introduced by Brigitte Velkeniers. We made a very small change to the program. Brigitte will chair the first session and I will chair the second one, contrary to what is written on your documents. We'll see. I'll see you later.
So it's my pleasure to introduce to you Professor George Griffin, who is president of the Federation of the European Academies of Medicine. He is emeritus professor of infectious diseases and medicine at St. George's, University of London, and a board member of the Public Health England and a fellow of the UK Academy of Medical Sciences. And I think he's going to introduce his first session together with Professor Caie, president of ALLEA. Professor Caie currently serves as Vice President of ALLEA, the European Federation of Academies of Sciences and Humanities, and he is on the advisory board of British Council Scotland and then the court governing body of Queen Margaret University in Edinburgh. So please, may I invite you to give this introduction.
Thank you very much, Brigitte, and of course I must thank the Royal Belgian Academy, and particularly Pierre and Jean-Michel for allowing us to be here in this wonderful building. Thank you very much for doing that. It's a great privilege to be here, and as you'll hear in a moment, I'm going to emphasize this word, privilege. We are all privileged in this room. We have a roof over our heads, we have warmth, we have fresh water to drink, we have good nutrition, and most important, we have education, because we know now, of course, that education is one of the biggest factors in governing public health. Smoking, for example, one of the big determinants of public health, is clearly linked to education. Imagine if our homes were bombed. Imagine if we had no water. Imagine if the supermarkets were bombed and there was no food. And then you had to walk 1,000 miles to get to somewhere that you thought was sanctuary, to be met en route by barbed wire and no access through certain countries. That is not privilege, that is underprivilege in a major, major way. And the effects that has on health, both mental, spiritual and physical, as we'll be talking about today, are huge. And this poses great strain on individuals, but it poses great strain because of the massive numbers of people, as we'll hear, on political systems trying to help people out of this situation. So it's been a great pleasure as part of FEAM to work with ALLEA, one of our great friends, very like-minded, to think about this question. And today we hope that we will be able to at least dissect out some of the major questions which are being given to these people who are underprivileged in the world due to their migration status. So I look forward to this conference with great anticipation. And this will be the first conference of two. There is one we are holding in Paris, and Alfred is here, where we are looking at health inequalities. And this needn't, of course, talk about migration. It just talks about health inequalities in the countries that we all live in. So these two conferences, in my view, are very pivotal for thinking about health within Europe. So it's a great pleasure and a great privilege to be here today, and I look forward with great anticipation to this meeting. So welcome everyone, and thanks again to the Academy here.
Well, I'd like to add my thanks to the organisers, first of all to our hosts, Professor Coulie and Professor Velkeniers, our hosts at the two academies, Professor Griffin, who we've been working with from FEAM, and Professor Feudat, who has been the lead organiser of the conference. And ladies and gentlemen, this is an incredibly important topic, as George has been telling you. Something I think that not only in Europe, but globally. I should maybe explain a little bit about ALLEA. My name is Caie. I'm the Vice President of ALLEA. We have 40 academies, 40 countries we represent in about 50 national academies. So we're sort of an umbrella organisation covering the sciences and the humanities, social sciences as well. And since its foundation in 1994, ALLEA speaks out on behalf of its members to promote science as a global public good. And we also facilitate science collaboration, and this is a good example today of how we collaborate, by bringing together the best scientists across Europe, well, not in the Council of Europe, because we are not only in the EU, but we cover the whole Council of Europe. And we provide science advice to policy via multiple initiatives, such as today's conference. We also work along with FEAM in what's called SAPEA, which is the science advice for policy to European academies. And we provide evidence-based policy advice to the European Commission via its scientific advice mechanism. And so vitally important is interdisciplinarity, as we'll see today, with economics, social science, etc. We're also independent, and we give timely scientific advice. So we greatly appreciate the opportunity to work with FEAM. This is very important on this incredibly important topic. Well, I mean, what is a migrant? What is an immigrant? It's a very large topic. It's not a new phenomenon. It's people have migrated throughout human history. And I believe that today, 1/7 of the world's population is now living in a location different from the one in which they were born. Let me give a personal example. In 1968, when I was going to do my PhD studies in Canada, I boarded a ship from Glasgow to Montreal. 99% of the people, largely men on that ship, were unemployed shipyard workers after the closure of most of the shipyards in Glasgow. We arrived in Montreal, we were welcomed with open arms, we were called New Canadians. And the Syrian gentleman we met last night actually said he would like to be known as a new Belgian, rather than an immigrant or an asylum seeker. But today, of course, it's very different. The world looks at migrants very differently. There's been a rapid increase in the number of migrants, as you know, from multiple reasons, from many, many different countries. However, another equally important aspect for them is health. And as a result, the need for healthcare systems in host countries to adapt to these recent changes. Now, migrants, as George is saying, are fleeing for their lives, are often met with punitive border policies, arbitrary detention, abuse, extortion, fear of deportation. Of course, this leads to one of the major problems in health, namely mental health issues. But all have the right to the highest attainable standard of health according to international law. All migrants are entitled to equal access to preventive, curative and palliative care. Now, can I add again a personal thing? As a linguist, I'm very much aware of the problems with interpretation, with translation. My university, University of Glasgow, has a big project on ethical interpreting in healthcare settings for migrants, because I think unless we have trustworthy professional translation systems, migrants will struggle to convey their symptoms, and there's also an issue of trust. There are many ad hoc, inferior interpreters used, or indeed they even distrust the GPs, that they might report them to the authorities, and a misunderstanding about how personal and patient information and data might be used in relation to immigration status. And this is the problem we have in Glasgow, and I expect it's true in many places. But access to good quality and equitable healthcare is an essential aspect of social inclusion of migrants. These people have gone through traumatic experiences, have put their lives in peril to reach a safe environment in Europe, an environment that will help them succeed. And in turn, European societies should follow a pathway marked by solidarity, shared responsibility, where respect for human dignity, democracy, equality determine our common agenda on migration. And we should further leverage national and European efforts to address migrant health by working together in an effective way and by meeting our international and ethical obligations. Now, to inform health policy decisions, particularly around the burden of migration on health systems, we need a robust evidence. And though data on migrant health service use is inconsistent across Europe, such data is needed to ensure that policy decisions around entitlement to care or health priorities are evidence-based, and to advocate for accessible, appropriate services for migrants. And for that effect, academies that assemble cross-cutting, multidisciplinary expertise are well placed to act as a source of independent, trustworthy information by synthesizing scholarly acquired knowledge across all disciplines. Again, a personal note. I come from Glasgow, which some of you will know is being known as something called the Glasgow effect, because we have very, very poor health welfare conditions. It has the lowest life expectancy in the UK. Premature deaths are 30% higher in Glasgow than the rest of the UK. But it's also a city that welcomes and supports migrants. We have the highest percentage of refugee asylum seekers in the UK, at any rate, with about 10,000 migrants, both asylum seekers and refugees. But the problem is that 2 out of 3 of them live in areas of social deprivation in Glasgow, which affects their health. There's one 40-year-old asylum seeker told me, he says, I know about healthy eating, I know what will make me healthy, but I can't afford it. And therefore I buy that £1 pizza instead. Last year, as George has mentioned, we had a highly successful symposium in Amsterdam. You've got the report of it in your bundle. And that was on health inequalities that showed socioeconomic disparities. And today we look at the same topic but from a different angle. And I'm confident that each and every presentation will spark your interest to engage in a constructive and lively dialogue, so we can leave the room at the end of the day with important messages we can pass on to policymakers. Thank you very much.